So, a rundown of my signs of labor. I've talked about back pain, I've talked about emotional changes, I've talked about frequent urination, I've talked about presence of show, which is the bloody discharge that is going to be seen few days before labor or just before the start of labor. I've also talked about your water breaking, which is a break of amniotic fluid which houses the baby. I've also talked about contraction and tightening, which is active sign of labor. Labor varies from person to person. You might have reduced pain and shorter time to delivery, while another woman will have traumatizing pain, and then her labor might take hours compared to yours. People are different, and so is their pain threshold. Some of you get unnecessarily worried about when the baby is coming out. So this is me saying, as a midwife, a nurse midwife, that the baby comes when it's ready to come. Yeah. The only thing you have to do as a pregnant mother is to look forward to these signs, or the signs of labor I'm going to be teaching in this video. First sign you're going to see is the emotional changes. I know when we talk about emotional changes in pregnancy, it's already a very complex case, but it's going to be more worse. You're going to be impatient, you're going to be tired, you're going to feel frustrated, you're going to be irritable and very angry. You know that tension that comes towards the end of you achieving something. Yeah, that's how you're going to feel, but it's all natural. And just try to find ways you could actually cope with this emotional changes that is definitely going to come. Then we have the baby's head descending into the pelvis, which is a very unique sign. It shows that the baby is willing to be born. There's nothing you can do to influence this. Descent of the baby into the pelvis is very spontaneous. So there is hardly anything you could do. It's just one of the signs that says, the baby is ready to be born. So my third point is back pain. I know you're going to say that what makes this very unique, because of course there is already back pains and discomfort in pregnancy, but this is more severe, a little bit severe than the usual back pain. Okay, and this is because of more pressure on the backbone due to the descent of the head to the pelvis. So yeah, you're going to have a bit of back pain more than usual. It will come with a bit of tightening, okay, radiating to the back and all that. So yeah, just look forward. If you are very conversant with your body, you should be able to detect the slight change. This is all sign that something is really to pop out of you. Then I have frequent urination, which is going to be more severe than the way you're going before. There is now more pressure on the bladder than it was before, okay, due to the descent of the head, and so you're going to have to pee in small quantities more frequently. Okay, that's another very beautiful sign. My number 5 is what we call show in the medical field. It's a blood stain discharge. We call it mucus plug, which is usually bloody, could be pinkish also in color, or a light yellow in color. You could experience a show a few days before labor or just at the beginning of labor. My number 6 is water breaking. You will feel a trickle or sometimes a gauge of liquid or water gushing out of your vagina just before the start of labor. Sometimes you might not see it because there have been cases where your midwife will have to use her fingers to actually break your water, or just look forward to it. It's actually not pure water, it's amniotic fluid. Then I have contraction and tightening. It sometimes feels like a period cramp at the beginning before it progresses to an unbearable level depending on your pain threshold. It sometimes starts from the stomach or from the lower abdomen radiating to the back. Okay, the level of contraction or pains you're feeling together with the contraction definitely depends on your pain threshold. Contraction and pain start slowly at the beginning, but since progresses and increases as you progress actively into the first stage of labor. A rundown of my signs of labor. I've talked about back pain, I've talked about emotional changes, I've talked about frequent urination, I've talked about presence of show, which is the bloody discharge that is going to be seen few days before labor or just before the start of labor. I've also talked about your water breaking, which is a break of amniotic fluid which houses the baby. I've also talked about contraction and tightening, which is active sign of labor. If you're watching this video at this point and you're preparing for your delivery, congratulations, dear mom. I pray the good Lord guides and protects you, and you would go home with your bundle of joy.